I'm Scott Cipher, and welcome to Back in a Minute. Dr. Scott here in Back in a Minute. Welcome back, welcome back. I just want to start today's presentation with a brief description of what the chiropractic lifestyle is, what the philosophy is. You know, chiropractic lifestyle to me has always been an active lifestyle. It's a wellness care rather than a sickness care. And everyone's really upset about how much the drug charges are jumping on some of these drugs. Make note here, some of the drugs. This is methocarbamol. That's a muscle relaxant. It went up 1,137%. There's antihypertensives for high blood pressure. That went up 469%. Pain relievers up 252%. And it go so on and so forth. It talks about pain relievers and heartburn. So the one thread that is consistent with all of these, I think a lot of these can be if in one word would be stress. And of course, in the chiropractic world, there are three kinds of stress. There are physical stress, chemical stress, and emotional stress. So how you react and respond to these is unique, and chiropractic can help you. We're not trying to replace this, we're trying to reduce the need for it. So there are two or three ways to determine if someone has joint restriction that's in need of a chiropractic adjustment. And I was using myself today as an example where when I turn my head toward the left, it hurts on the left. So this is my homespun model, and it explains how the tissue, which is represented by these rubber bands and guide wires, as you move these tissues, it stretches one way and the other. But what I wanted to point attention to is this little between the white and the blue it's called a facet. There's pairs of facets on the left and right all the way down. And so what happens is if I were to kind of turn my head this way and extend backwards, then the neck rotates, and then the facet, these two flat plates will actually come together, literally and mechanically. So if you turn your head to the left and it hurts on the left, the chances are that the joint is locking and not moving. And there are a rich and plentiful supply of pain and mechanical nerves in that area. So one of the ways, so that all the sensory information comes up into the brain. Here's the brain, and then the brain sends a downgoing signal to try to stabilize the area in a 1:9 ratio. But if that persists over a period of time, these nerves here in the lower part of the neck actually go down into my arm. So what I can do is first I could do the range of motion. Yeah, this is not moving and it hurts right here. Then I could keep it in that position, put a little pressure on it, and it brings on more. And I started to feel it down my arm a little bit actually. Then I can take the hand and then push up, and it's weaker than when I push up on my right side. So now it's like a wiring diagram. Now I've isolated the problem to the lower neck by virtue of that's called applied kinesiology, physiologic challenging of the nerves to isolate the joint which is not moving. The last and most exciting thing is, but no, kids, there's more. That this has an effect. This has a profound effect on your balance center. Your visual cortex is wired into your balance. So, from a practical standpoint, this is where brain-based adjusting can come. So I'll use again myself as an example. So I'm sitting here, and I'm turning my head to the right, and I turn my head to the left, and I feel pain into the side that I turn to. That's a joint, and also a little bit going the other way because that's the muscle that's stretching. And then what I can do is I can close my eyes and then turn my head to the left, and I feel a little uneasiness with my eyes closed because the eyes give you feedback to help support. But then when I go to the right, I'm very stable. So what it's telling me is that this joint is not moving, and the brain we can check the balance of any patient to help determine specifically the side of the joint that's not moving. So I'm Scott Cipher, Dr. Scott Cipher. I'm going to sign off for now, and thank you. Please join us the next time for Back in a Minute.